What's in the first few months of recovery? Yes.
Yeah, I just wanted to mention, it's kind of a statement and a question. Well, you had mentioned gabapentin, and I am on gabapentin. I'm on 2,400 milligrams a day. Seems to be working great. I know people out there too, and I don't know if you're aware, people are abusing that a lot, and they're taking them in handfuls. And there's also, when I was off of my gabapentin, I experienced a withdrawal of some sort, and I actually looked it up on the internet. And I don't know if that's psychological or what, or if I just thought I needed it. Have you heard anything about that?
Yeah, I've heard the question is about gabapentin and it being abused by people. It is effective. It reduces anxiety. It's not a controlled substance. It's not. I've never seen anybody come into treatment and their drug of choice is gabapentin. I think addicts get into taking all kinds of stuff, and they'll take gabapentin just for the kick of getting a little more whatever. But it's not an addicting drug itself. As far as the withdrawal, if you're on 2,400 milligrams or so, yeah, you shouldn't go from 2,400 to 0. And if somebody takes gobs of it, they can have some, it might not be withdrawal, it might just be the difference in the day off of it versus the day on it. So it's not a it's a good drug, but any drug can be abused. Benadryl can be abused. Yes? Question is pregnant women going through alcohol withdrawal? Yeah, it's a good question. The Valium, all these medications are category C, which means they might be harmful, but they probably aren't. We don't know. But we got to treat the withdrawal. All we know is that the withdrawal is dangerous to the pregnancy, to the fetus. So we will use the same medications for a pregnant woman. Yes?
Many times when I'm withdrawing from alcohol, my whole entire body has uncontrollable shaking, and I can't just stop. What is that caused by?
That's just what we were talking about. That's the shakes of alcohol withdrawal. The whole body shakes. Yeah, that's just a symptom of alcohol withdrawal. The question was, his whole body shakes when he stops drinking in alcohol withdrawal. That's just the tremor stage. Yes?
Excuse me, I have a question about cold turkey, detoxing by yourself at home. Is there a point of where signs or things to look for where you know it's not going to be safe? Say you just have a hangover and you're shaking a little bit when you get up in the morning, you think, this will be okay, I'll be okay, by tomorrow. Is there some danger zone?
Yeah, the question is cold turkey, withdrawal at home, and kind of enduring the withdrawal at home. And how do you determine whether it's just a hangover or withdrawal? If you're shaking, you should seek medical attention. If you're having lots of sweats, you should seek medical attention. Anything more than just a little, God, I don't feel good, or I have a headache, should seek medical attention. So you know what a hangover is, but if it goes beyond that and you're having symptoms, shakiness, that's to do it on your own. By the time you get to the emergency room, you could be having a seizure or be in full-blown DTs. And once you get in DTs, you can't go back. Like I said, that one guy was in for 2 weeks and the other guy was in for 3 days because it wasn't treated aggressively right at the beginning. I think I'll let you go. It's 9:30 now, so thank you for your attention.